All right, your time is 6:33, and joining us once again this week, as she does every Wednesday, Dr. Namisha Amin, a local pediatrician, for our weekly series on kids and the coronavirus. Dr. Amin, thanks so much for being with us this morning.
Of course. Thank you for having me.
All right. So one of the things we've been addressing a lot lately and have you talk about is the vaccine research that's going on that has begun in younger children. And we just learned that Pfizer recently requested emergency authorization for their vaccine use in kids ages 12 to 15. So what do we know about this request? How quickly could this happen? And what do we know so far about the safety in kids those age?
Right. So most experts feel that the vaccine will likely be available to children ages 12 to 15 by summertime in preparation for the next school year. The authorization process took a few weeks for the adults, so we may actually even see it sooner than that, but it is ultimately up to the FDA. In terms of safety and efficacy of the vaccine in this age group, the data actually looks very reassuring. In the vaccine arm, there were only 18 cases of COVID. And I'm sorry, I got that confused. In the placebo arm, there were 18 cases of COVID. And in the vaccine arm, there were actually 0 cases of COVID. And this is in almost 2,300 children that were studied. In terms of the side effects, these children encountered side effects that were very similar to the 16 to 25-year-old age group, but their antibody levels were actually far more robust than the 16 to 25-year-old age group.
I think a lot of parents, even now, right now, when it's available to 16 and up, I think a lot of parents may be wondering, why should I get my child vaccinated against this disease that doesn't pose a significant health risk to them, especially when vaccine research is still so young?
And I think that is completely understandable. But it is important to realize that children are part of the COVID-19 equation. In fact, they account for 13 to 14% of all of the cases that we have had here in the U.S. And they can be hospitalized, and unfortunately, some can even pass away. We've had up to 350 pediatric deaths from COVID in this last year, and that's more than an average flu season. In addition, if we want to reach herd immunity, if that is a goal here in the United States, then again, kids have to be part of the vaccine rollout. But again, I don't think kids should be part of the vaccine rollout until we know for sure that the vaccine is in fact safe and effective. Thus far, the data suggests that way, and the FDA will again take several weeks, if not a few months, to look over this data to make sure of that. I think the nice thing for those parents who are concerned and are hesitant to be one of the first to get their children vaccinated will have the same opportunity that adults here in the United States had. There are going to be other families that are going to volunteer their children to receive the vaccine as soon as it is available. And as parents start to see thousands of children and then ultimately hundreds of thousands of children become vaccinated, they may start to be more reassured that the vaccine is in fact safe for their child. And it's important to know that most vaccine side effects, the vast majority, are going to be seen within the first 6 to 8 weeks after a vaccine is given. We have more than 2 months of data for these young children who have been studied, ages 12 to 15, and they will continue to be studied for the next 2 years.
All right, let's talk about another really interesting study I saw yesterday about breastfeeding while you have COVID. And I'm sure this is a big concern for a lot of new moms out there wondering, what do I do if I am testing positive for this virus, and I want to keep my newborn baby safe. What do we know so far about breastfeeding while the mother has tested positive for the virus?
It is 100% okay for the mother to continue breastfeeding if she has tested positive. The precautions that she should take in place is that she should wash her hands every time before picking up the baby, and she should wear a mask while she is in close proximity with the baby. There is no evidence whatsoever that suggests that the virus could be given to the baby through the mother's breast milk. In fact, vaccine data tells us that antibodies against the virus can actually be given to the baby, and we would assume as such with a natural infection, and so the mother continuing to breastfeed may actually protect the baby from infection.
Wow, that's very interesting. All right, Dr. Namisha Amin, unfortunately we are out of time, but thank you for joining us again this morning. We appreciate it.
Of course, anytime.